Well, good morning, everyone. Thank you for joining us for the Cal OSHA COVID-19 Standard End of the ETS webinar. My name is Nigel Bocanegra, and I'm the Executive Director for the California Farm Labor Contractor Association. I'd like to go over a few housekeeping items before we begin this morning. First, I'd like to thank UC Davis Western Center for Agricultural Health and Safety for sponsoring today's webinar. You'll receive a link to review the webinar recording and the slides after the conclusion of today's session. We will have a Q&A at the end of the presentation, so please submit your questions in the Q&A box at the bottom of your screen. I will now hand things over to today's presenter, Bill Krycia. Bill is the Senior Safety and Health Consultant with the Zenith, a certified industrial hygienist with a master's in public health and has over 40 years experience in occupational safety and health. Prior to working with Zenith, Bill's career at Cal OSHA spanned the range from field inspector to regional manager. He is involved on a national basis with NIOSH and locally with the Western Center for Ag Health and Safety at UC Davis. Bill, take it away.
Good morning, Nigel. Thank you. All right, let's do a screen share here. Let's get this up and slideshow. From the beginning. And do you see my opening slide?
Yep, you're all set to go.
Okay, all right. Well, thank you everyone for being here. This was kind of thrown together on a sort of short notice. We appreciate you folks being here. I recognize that everyone is fatigued, is not quite a good enough word for hearing about COVID stuff, but I think it's really critical and that you pay attention because the regulatory network has changed. So is it going to be the end of the ETS? Yeah, kind of, but that doesn't mean you can back away from it, right? So last week, the Cal OSHA Standards Board passed a non-emergency standard. And I'll repeat myself several times in the next 20, 30 minutes. You have to have a COVID program. Absolutely have to have a COVID prevention program, right? The proposed regulation that the Standards Board put together has a sunset of 2 years from when it's approved by the Office of Administrative Law. So this is all regulatory bureaucratic stuff, but that'll probably happen in January with very high probability. And so that means it'll go into effect probably in February. But in the meantime, there will be no lapse in enforcement or requirements for folks to follow the key elements of the emergency temporary standard, or what we'll call the ETS, right? Does that mean no more COVID regulations? Absolutely not, no. So you can't back away, you can't just drop things. And in fact, if you follow the news, if you follow some of the CDC reports, I know that the SAC-B, LA Times, and other newspapers around the country are reporting on the significant rise in COVID. And I know that there have been a lot of holiday parties. I will share that I've been to one where we just got a COVID notice last night that multiple people who attended that holiday party tested positive for COVID. So I'll be testing later today. A news release came out, and I'll send you links. When you get the PowerPoint, you'll have links for all this if you need to share this with anybody else. But the news release came out on December 15th, and from the board, from the Department of Industrial Relations on behalf of Cal OSHA. And it talks about, okay, hey, listen, they passed the standard, right? It's got to go to the OAL before it's effective. Again, there is no lapse in enforcement. Right, so you definitely need to have a program. And I will say it now and again, several times this morning, if you don't have a COVID program, you need to have a COVID prevention program, a written COVID prevention program, and other things that we'll talk about in just a second, right? So many of the elements in the proposed standard, right, the pending standard, I should say, are in the emergency temporary standard. So there are things that you've had to be in compliance with over the last year and a half, 2 years, right? So the written program, and I cannot stress that enough. Those of you poor, unfortunate folks who attend the 9-hour FLC training session that I do, you know that I harp on you have to have the written program. And there's a couple of reasons. Number one is the penalties for failing to have a written programming in California are 12 to 18 grand. And let me repeat that. That's $12,000 to $18,000 for not having a written program. And you make it that reduced on appeal, that's going to be a ton of time and resources on your half to get it reduced. One of the reasons that they're doing that is they want to highlight the fact of the importance of having a COVID prevention program. And with the data, the way things are going, you know, we've got a winter spike in transmission, which happens with infectious diseases like the flu. We've got the flu and RSV and other things going on as well. You need to have a program. Please have a program, right? You have to do employee training. You know, I know it's off season, but there's no off season for these infectious diseases. You have to do the training. Some training is better than none. We've got some resources. I'll talk about those both from the Western Center. And again, thank you to the Western Center for sponsoring this. There's resources there. Cal OSHA has face coverings and respirators, COVID testing, like the test that I'll take later today because I was potentially exposed at a holiday party. You know, that has to be provided like it was under the ETS for during work hours and at no cost to employees. The ventilation section, we'll have to decide, you know, what's going on with you folks, and if that's a big issue, that I think almost warrants, and I haven't asked Nigel about this yet. Excuse me, that warrants a special, maybe a shorter podcast or something to talk about all the requirements of that. But that's in the standard. Case tracking, just like in the ETS, is in the permanent standard. And then employee and agency notifications are there. There's some change in the pending standard, so you don't have to necessarily notify every employee. You can do some workplace posting, but we'll get into all of that and where that's going to come from. Cal OSHA did send this in. Again, you'll have the link for this in just a little bit. You know what's required of employers at this time. And so they talk about everything I've just said, right? If you have to share this, they also talk about these regulations apply to most workers who are not covered by the aerosol transmissible disease standard. And I just want to highlight that for a second, because you folks aren't covered by it, right? If you worked in a hospital, if you were a first responder, a police officer, a firefighter, those folks are covered by the aerosol transmissible disease or ATD standard. Very specific requirements as far as respirators, training, medical review, all that kind of stuff, right? That doesn't apply to you folks in ag, right? And so that's why they wanted to generate the separate standards, the COVID standards, the ETS, and now the permanent standard. So you have to have that, right? The other thing that's highlighted in this document, which is one of the earliest and only documents that we have at this point in time, is that there's a real pressure for employers to monitor what the California Department of Public Health, which is CDPH, that you see on the screen here, what the California Department of Public Health requires, as far as masking up, respirators, all kinds of things, right? So there'll be a tremendous push on that. I have just had a chance to chat with Nigel. The newsletter, the CFLCA newsletter, will highlight all these things. So it's really, really critical. Again, those of you who have participated in the 9-hour FLC training, you've heard me harp about read the damn newsletter. Well, this is another reason, even a more critical reason to read the newsletter and see what's going on and what the changes are. Okay, so you're going to have to provide, and this is part of the ETS, and there's some minor tweaks to it, right? You have to provide respirators or face coverings to employees who work indoors, work during outbreaks, outbreak being 3 or more potential cases or confirmed cases in a 14-day period. And that again is also tied to California Department of Public Health. I really struggled with, I don't want to over-engineer it. We could have a several-hour presentation on this. You don't need to do that. Again, please have a written program. We'll give you the resources, Western Center, Cal OSHA, have them. FELS has a Farm Employers Labor Service. Other folks have programs. Zenith has programs. Other carriers have programs. The Zenith model program, which is perfectly adequate at this point in time, it's like 4 or 5 pages. The Cal OSHA program, on the other hand, which is from Cal OSHA, covers a ton of stuff and it's 31 pages. That's, I think, a little over-engineered for most FLC, right? It talks about excluding COVID cases from the workplace. So if somebody tests positive, they can't come to work, right? But it doesn't include COVID pay, exclusion pay. And that was a big issue. And a lot of politics involved in that. Maybe at a subsequent session when we're fortunate enough to have Erica Rosasco. Oop, I've got to plug in my thing before we lose. Sorry about that. Webinars all morning long. Hang on, folks. Sorry. Okay. All right. So we should be good now. All right. So we're all powered up again. Maybe Erica Rosasco can talk about all those issues. But at the present time, the proposed standard, the pending standard doesn't have anything about exclusion pay. And the board almost didn't vote for the standard, but they were on, all the folks on the labor side were pretty upset about it. They voiced their opinions, but they still decided it was critical to have a permanent standard. There are other standards down the road, permanent infectious disease standards, in addition to the COVID one that they've talked about. The Deputy Chief Eric Berg has said would include an exclusion pay component, but that's probably several years down the road. And again, you know, CFLCA will keep you informed on that. You'll have to assess and modify indoor ventilation. That's a critical issue. And say like working in a packing shed or any place where you have a forced air ventilation system other than you just roll up the doors on either side of the building to get fresh air in the on the interior. You're going to have to do some things on the ventilation system. And we're looking forward for additional guidance on that, which should be forthcoming. Right? And you have to keep records on COVID cases, which you've already had to do. This is one of the things. I mean, we're very early on and we're really trying to give you folks a head up. I'm trying to make sure that you understand you have to have a written program even now. Some folks are saying, okay, you know, the ETS has gone out the window. You don't have to do anything. It's you know, especially a holiday gift from Santa. You don't, it's like, nope. Again, I want to make it really clear. You have to continue on with that program, right? So further guidance, again, CFLCA will include updates in the weekly newsletters. Cal OSHA has posted created a web page, which we'll give you the link to in just a slide or so. But a lot of the stuff is you know, coming soon. Some of the materials, like the one handout I already highlighted, is available in English. It is not available in Spanish yet. The Western Center, I had a chance to talk to Heather Ryden yesterday. Western Center is very aggressively pursuing developing written materials, model programs, and training materials. And you have to remember, a lot of the training materials that applied to the emergency temporary standard are good for the proposed standard. So if you haven't done any training yet, you don't have a written program, you can go to the Western Center, and you can go to Cal OSHA, Western Center, you can go to Zenith. There's a bunch of resources. Please have those programs, right? But wait, the ETS is still in effect. I can't harp on that enough, right? I don't want anyone to get hit. You know, there's 40 to 60 new inspectors out there. I'll say that again. That's what they need. They know how to do. You know, my line that I use in the FLC training is they've never seen a live tractor or a real cow before, but they know how to cite for these programs, and they want to make a name for themselves. I have talked to some of the field inspectors, and they are providing. They don't want to write a ticket for 12 to 18 grand. Some of the folks, and so you may run across an inspector who will give you a copy of the model program and tell you to fill the darn thing out, right? But you may not. And you may get hit with a 12 to 18 grand fine. We don't want that, right? You have to have a COVID prevention program, still need to train your employees. And in the future, you're gonna have to pay more attention to what the California Department of Public Health, local county public health are gonna require. If we have a really bad outbreak here in the next several weeks, there'll be something in the newsletter that, you know, we'll here at CFLCA, we'll pay attention to that. We'll let you folks know what's going on. If you have any questions, you can respond back to CFLCA, and we'll do our very best to try and answer them. The standard, again, the permanent standard won't go into effect probably until February, after, you know, the government does its stuff, the Office of Administrative Law, but there's a lot of pressure on them to push this through. And so we want to make sure that you're prepared for next spring. I know that enforcement folks will probably be in enforcement, a sweep or an effort. It'll definitely be on inspectors' checklists to look for. You may get a good inspector who gives you a model program. I wouldn't bet 12 or 18 grand on that, right? I mean, so that's super critical. And with that, I think the prepared part of this is done. Here's some of the references. Here's the links, and again, you'll get that. The press release on the standards board passage, which outlines some of the bullet points. I didn't want to over-engineer the talk this morning. What employers need to know. The link for the Western Center is there as well. A lot of good basic resources. So if you haven't done any training, again, you don't need to pull everybody in for 8 hours of training. You have to do some kind of training and document what you do. You know, we always talk about documenting stuff, and I know a lot of folks will say, well, yeah, we do a quick little tailgate thing. Those are beautiful and they're critical, but you need to document those somewhere. And with that, Nigel, any questions, any other comments from you? I think we have like 10 minutes or so left.
Thanks, Bill. Folks, as a reminder, if you have a question, you can submit it through the Q&A button on the bottom of your screen. And as another reminder, you will be receiving a link for the slides. So if you didn't get a chance to copy down those URLs that Bill had in the last slide, you'll be able to access that through the slides. Currently, Bill, we don't have any questions in the chat, but I do have a question for you. You've mentioned the fine for a failure to have a written program will be between $12,000 and $18,000. Do you know what the determination is on where someone might end up in that range for failure to have a written program?
So I think what the division is doing, and they actually started doing in this on some of the heat citations, failing to have a written program, they're perceiving it as potentially a serious issue. And so a serious citation, the penalty is going to range for between 12 and 18 grand, possibly even higher in some cases. And general citations of penalties, as the slide we do in the use in the 9-hour FLC class highlights, have gone up. And so even at the high end of the lowest level of citation, a general citation, it could be $12,000. I know that there's been a push on, excuse me, there's been a push on from the enforcement folks to highlight the fact, the severity of this, to get this out there and to make an impact on the industry, not just agriculture, but any other industry. And I know that, many FLCs can't absorb a $12,000 or $18,000 ticket. Some can, maybe, but I, strongly, if you do get hit with a ticket, at the seminar that we had in Visalia, we talked about, how to conduct an appeal and follow up with that. All good information is something to consider down the road. But don't get there. Have the program.
Thanks, Bill. We do have a question that's been sent in. With seasonal employees that come and go, does training have to be scheduled each month?
No, training doesn't have to be scheduled each month, but if you have seasonal employees, and we understand that it's very, especially in ag, it can be very fluid from week by week, right? But you need to do something. And so, again, the resources, you can take a look at the resources available at the Western Center. They have some really good diagrams and posters that I personally like in English and Spanish right now that address COVID health and safety and COVID prevention under the emergency temporary standard that would still apply to the pending standard. And so, you should be able to put together a quick tailgate for those folks, a couple 10 minutes, 15 minutes at the most on that, I think would be adequate. And again, documentation of all that kind of stuff, critical.
Thanks, Bill. Again, folks, if you have a question, you can send it in through the Q&A button at the bottom of your screen. I do not have any other questions currently in the chat, Bill. So unless we receive another one, any closing thoughts before we wrap up today?
Yeah, I think that, again, I really feel strongly, and I want to convey to everybody that they need to have that written program. If you don't have a written program, don't wait till after the holidays. Don't wait till February to get one. The Cal OSHA folks are out there. It's very high on their priority list. Management in Cal OSHA, other folks are looking to see if folks are having a program, they're looking to address that. I know some of the inspection, even if it's say an accident inspection, which unfortunately there are accidents in ag all throughout the year. Cal OSHA response are going to ask for a program. You don't have a program, you're going to get whacked. And we don't want that, right? And it's also critical to maintain, some sort of training. The use of masks, employees are protected if they want to wear a mask, even if it's not required by the California Department of Public Health. There's a lot of stuff out there, and unfortunately, the data shows we're kind of looking at a spike, unfortunately. Between the flu and RSV and COVID, we're just looking at a spike, and we don't want that. We don't need that. We can do some things to control it on the ag side, and I know folks have been doing a pretty good job recently, but we cannot slack off this time of year, and there should be a ton more resources. I know you're tired of hearing about this stuff, but stay the course. And happy holidays.
Thanks, Bill. We've actually received several questions in the chat here. Which is better, in your opinion, a large program that addresses every little aspect of the workplace, or a more generalized program without a ton of detail?
Well, I think you have to have what Cal OSHA calls an effective, air quotes, right? An effective program. And that's why if you take a look at the materials that are available to you through FELS, I'll plug FELS again, Farm Employers Labor Service. I'll plug, the Western Center, are a sponsor today. And even a lot of the Cal OSHA materials are pretty darn good. And so you can use those materials. Doesn't need to be down into the weeds about, which particular strain of COVID it is, and talk about, what Dr. Fauci said 18 months ago, not to get everybody all riled up or anything. But no, I don't think you need that. But you need to have some sort of training on, proper protection, proper wearing of a face mask, what the limitations of face covering are as versus an approved respirator, and signs and symptoms of COVID, which are, pretty vague sometimes. I mean, as far as fever, respiratory distress, could be the flu, could be RSV, could be a cold even. But they need to understand if they have those symptoms, they should be tested, and the appropriate, they have access to tests through work. You have to pay for the tests. And I think I just saw something on the news the other day, the government, and I still believe the Western Center, if you don't have any the rapid tests, you can reach out to the Western Center. I forgot to mention this to Heather yesterday, but I know that they had a fairly decent, robust supply of rapid tests. And so if you need a rapid test, you can reach out to the Western Center at UC Davis, and they can.
Thanks, Bill. Our next question states, do you recommend having a separate program on COVID still once the new non-emergency rule is approved, or is including it within the IIPP more beneficial?
The standard, actually, the proposed pending standard talks about including it as part of your IIPP, and that's okay. I honestly think with damn near 40 years of enforcement background, if you have a separate program and an IIPP, if somebody whacked you for that, the judge will laugh and throw it out. Don't hold me to that. I know we're recording this. I'm not an attorney, but yeah, I think whatever works for you folks, right? In the past, it said, oh, it had to be a separate, the ETS said, oh, it had to be a separate standalone program. Have the program. That's what matters. Do the training, document that. That's what matters.
Thanks, Bill. I think we have time for perhaps one last question. The new non-emergency regulation extended through December 2024 includes, quote, identifying COVID-19 cases in the workplace, excluding any employee cases. What do they mean by excluding employee cases?
Well, I mean, how many days do we have to talk about that? We could make it a 40-hour seminar on that. I think that guidance will come from the California Department of Public Health on that, on what employers can do. That will be something that will probably, unfortunately or fortunately, be challenged legally if OSHA decides to cite somebody for that. But it's been difficult. There have been, even during the recent months under the pandemic, it's been difficult to isolate, very difficult to isolate exposures at home, exposures at a holiday party versus exposures at work, say the maintenance crew or a particular picking crew. I don't have a straight answer for that. I think we're going to have to look and see under the frequently asked questions that OSHA has promised to put out under guidance from the California Department of Public Health, what sort of distinctions and guidance that they'll have. And again, as those things change, Nigel's going to put everything in the newsletter. He promised me.
Thanks, Bill. With just about 1 minute left, someone submitted a question saying that they had some technical issues earlier in the presentation. Can Bill please say again what the training should consist of?
Oh, the training that you had to do under the emergency temporary standards. So you need to talk about, the recognition, the signs and symptoms of a COVID illness. You need to talk about what employees need to do as far as face protection, sanitation, the dreaded social distancing, 6 foot has been kind of sidelined a little bit. It still is, as far as best practices go, if you can space employees out, that's always a good thing. But we recognize that, especially on planners and other lines, you just can't do that. But the training requirements that apply to the ETS are pretty consistent with what's in the pending standard. And if you need assistance in looking at that, Western Center has that, OSHA has that, and the standard itself, the 3205 will have.
Thanks, Bill. Thank you
You're
for
welcome.
joining us today and sharing your knowledge of the ETS with us. Folks, if you ever have any questions on developing a COVID plan that's specific to your business, you're always, of course, welcome to reach out to us. And if we don't have the exact answer, we can certainly connect you with someone who does. Again, you will receive a link to review the recording of today's webinar, as well as the slides after the conclusion of today's session. Thank you for joining us today. Take care, have a happy holiday, and we hope to see you again soon. Take care, everyone.
Take care, folks.